Have you ever gone to the doctor with a particular complaint, such as stomach pain or back pain, maybe something with your foot, something like that, only to come out 20 minutes or so later without your complaint having been addressed? Has that ever happened to you? Chances are it has, and I say this as a family doctor myself. I've seen so many patients in my office who I've sent to specialists or who have seen doctors who say, you know, I went there for this, but the doctor only talked about that, meaning they didn't ever address my concern. Guys, today we are talking about 4 strategies and ways to advocate for yourself in the doctor's office. This is really important because it can be easy to go to the doctor and come out wondering what just happened, what in the world am I supposed to do? So what about the issue I had? And regarding that first issue, by the way, the first tip is to make sure that your medical issues are actually addressed. That is right. When you go to the doctor, make sure that you keep the focus on what you're there for. It doesn't mean that you don't go along with your doctor or follow them along their path, etc., but just make sure that by the end of the day, by the end of the visit, that what you came in for is actually addressed in some way. Understanding that maybe it'll have to be addressed another day because maybe something else is more important according to your doctor or what have you. But the idea is make sure it's very clear what your concern is and what the plan is about that particular issue. Don't let that be sort of left up to chance and you leave feeling like, gosh, what just happened? Did I even get help for my back pain or my butt pain or my foot pain? Okay. Second thing is to make sure you understand the what, when, where, and why. Also the how as well. That means understand what it is your doctor wants to do, why they want to do it, and how you're supposed to get it done. So many of my patients, I go to explain to them what I want to do and why, and it's only actually after the visit when I get a call from them saying, hey, Dr. Caudle, what did you say about this? Or why are we doing that? That I realized that perhaps I wasn't clear, or perhaps I was speaking in med speak, maybe not like English, but in sort of, medical jargon. Or maybe I didn't stop to take a moment to ask the patient, hey, are you following me with this? Now, chances are this might have happened to you when you've gone to see your doctor, whether it's a specialist or primary care physician. The idea, though, is that you have every right and you need to know when you leave that office visit what they want to do about your issue, why they want to do it, and how you're supposed to get those things done. So what they want to do, if they want you to get extra testing, okay, understand what the testing is supposed to do or supposed to tell them, what they're testing and why, and then also how you're supposed to get that testing done. And I would also say when they want it done, the doctor that is, okay? All that stuff is important. I say, I'm always on doing my videos with a notebook. Bring a notebook into your office visit so you can write this stuff down. Sometimes it can be overwhelming and very confusing. It can be a lot of stuff. We know this. So make sure you write this down and you keep track. This is how you can help advocate for yourself. The third thing is to make sure you bring your medications to your doctor's office or a list. I know I say this in so many visits, but it's so true. Do not rely on your doctor to keep your list. In other words, I have a lot of patients that say to me, oh, my medications haven't changed. It's the same as whatever you have in the system. No. What I have in the system may not actually be what you're taking, or what I think you're taking may not be what you're actually taking. Do not just say, oh, it's whatever you have. I haven't changed anything, because you don't know what that doctor has. We should have the same things, but crazy things happen. So make sure you're reviewing your meds with your specialists, with your primary care doctors every time you go to the doctor's office. That is important. And the fourth thing, and the final thing, is to know when you're supposed to come back. This is huge. Because a lot of times I'll ask my patients after they've gone to see a specialist, oh, okay, so you saw the neurologist for your stroke follow-up, or okay, so you saw the gastroenterologist for your colonoscopy, or oh, okay, you saw the heart doctor for your recent chest pains. When are you supposed to follow up? And a lot of times my patients will look at me saying like, well, they didn't say, or I don't know, or I don't think I'm supposed to follow up. Guys, there is always follow-up instructions. The follow-up instruction can be that you don't need to follow up, but you need to hear that explicitly. There is always follow-up. Whether the follow-up is come back in 4 to 6 weeks after your lab work is done, follow-up in 6 months for your routine follow-up, or we have concluded this issue, you are better, you don't need to follow up with me because of X, Y, and Z. Guys, don't ever leave a doctor's office not knowing when you're supposed to go back, because there is always some guidance to be given about that. This is super important. And remember, for chronic conditions or things that you might need to see a specialist for, many of those things will not just drop off the list. They will not just go away. You know, if you've had a heart attack in the past, if you're my patient, I'm going to want you to see cardiology every so often until, okay, that's not going to stop. Okay, so understand that it's not that you may have those active issues, you may not, but the idea is that follow-up and routine sort of management by a specialist or a primary care doctor still is likely. So make sure you ask, when are you supposed to follow up? Guys, I'm Dr. Jen Caudle. I'm a practicing family physician and on-air health expert and video creator. I do daily videos on all sorts of stuff. If you have not liked and followed my page, I invite you to do so. For those of you who send stars, I so appreciate you. I respond to you personally. Guys, I'll see you soon.